Hi, I'm Dr. Nilam Khurana, and I want to congratulate you. I wanted to talk to you guys about what we typically talk to parents about during a meet and greet, which is not happening these days because of COVID. Most of the things that parents want to know is what's going to happen in their first day or two at the hospital, and then follow up in the office and just things to expect. So after the baby's born, one of the first things to expect is that they will be giving the baby a vitamin K injection to help prevent bleeding and poor clotting, a hepatitis B vaccination, which is their first vaccine, and they don't get that next one until 1 to 2 months, eye ointment to prevent infections that they can get from the canal or just different exposure from the mother's bacteria. And then those things that are done initially, and then the next set of things don't really get done until they're about 24 hours old. Sometimes they'll do the baby's hearing before that, and if they do the baby's hearing and the baby passes, hooray. If the baby fails, or what they call refer, then it's usually not anything to worry about. It's just that there was fluid in the canal, like the ear canal or something, and they just weren't able to get a good test, and majority of the time they come back as a passing, either before you leave the hospital or they send you out after you are discharged home. And then feeding is the main big thing. If you're going to be formula feeding, nothing really major to worry about. The nurses help you understand. The baby's bellies are really tiny initially, and so they have to expand. And so they really just do very small volumes at first, 10 to 15 milliliters, and then slowly bump it up. If they're breastfeeding, again, the volume is really small, but it's colostrum, so it's jam-packed. It's got a lot of protein and fat, and it's going to hold them over for longer. And then as their bellies get used to absorbing or holding more food, they'll increase the volume of whatever they're drinking if they're drinking in the bottle, and the woman's body will naturally create more and more breast milk. And the breast milk usually comes in at about 3 to 5 days. Some women earlier, but that'll be sort of when they're eating a larger amount, and the amount that they eat varies significantly. It can still be 1 to 2 ounces. Which is 30 milliliters to 60, but usually it's more like 30 to 45, so 1 to 1.5. And then with the bottle, the only thing is you have to make sure you're not overfeeding. So when they breastfeed, they have to work at it. They're not going to work once they're satisfied and they're just using it as a pacifier. So they're not going to be able to get as much milk, although some of them do. With the bottle, it just pours right into their mouth. So they don't have a different type of suck necessary to get the milk coming out of the bottle. So when they're feeding out of hunger versus just using the bottle as a pacifier, they're still going to get stuff going in. So you really have to stop, burp them, make sure that they're okay, and not end up overfeeding them. And then we usually say no pacifier until their American Academy of Pediatrics says a month or 4 weeks. I usually say until they're back up to their birth weight, which is usually 1 to 2 weeks, if they're breastfeeding well and all of that. And we also recommend that they don't do a bottle if you're going to breastfeed. They have lots of different things that are available in the hospital if they're having a difficult time latching, including finger feeders and these little plastic cup things and just tons of things. So you just get lactation's help if you need to give the baby something other than the breast milk directly from the breast. And then, of course, worst case scenario, your baby needs to get the bottle, which mine did, because she wouldn't latch and she was too low in her sugar. And so she was threatened with the IV, and she said, all right, fine, I'll take the bottle. So with that, it was a pain. It took a while to get her off of the laziness of drinking from the bottle, but then she did okay. So really that first 24 hours is going to be working on trying to get that latch really good. And then at 24 hours, they do a heart test, which is really just looking at their oxygen in their arm and their leg, making sure there's no huge discrepancy. That gives us a way to be able to tell if the child has a congenital heart disease that we wouldn't be able to hear. They do a newborn screening, which is, some people know it as the PKU, but it's basically a bunch of blood spots that they do on this paper, and they test for a bunch of different things that babies can have that they're born with that, if not caught early and not treated, can cause lots of medical issues. So that gets done at 24 hours. And then again, when the baby goes home after they've been eating well and their poops have changed, which is typically around 5 days, they can get their second one done. They also will do this bilirubin test, which is this light thing they put on their forehead to see how much jaundice they have. So if they have too much jaundice at 24 hours, then they will be doing a blood test to determine whether or not they need to do any treatment for the jaundice, which is just shining these blue lights. It sounds like it's from an alien movie, but you shine the blue lights on the baby. It makes them pee out the jaundice until their poops change from that sticky, icky meconium, dark tarry stuff to the yellow seedy poops, which is typically that yellow is getting that jaundice out. And that again has to do with the liver maturing and all of that. So those are the big things that you'll have going on in the hospital. And then they'll tell you when you have to come back to your pediatrician. It may be the next day because they want to check and monitor the weight and make sure it's not falling too much. It may be 2 days. It's rarely more than that. Sometimes 3 days if it's a weekend. You get sent home on a Friday and there's no availability till a Monday. But otherwise, most of the time we want to get you in because we want to see how they're doing with their weight, their poops, their pees, and their jaundice. So expect to be getting into your pediatrician pretty soon after discharge, and then we'll be able to guide you a little bit more from there since you'll be in the office and we can give you all the information. So that's really the big stuff I wanted to tell you guys for your sort of intro to the pediatric world. And then also just wanted to let you know that I will be doing a developmental series as well as some other things to help you figure out some of the other things that you are supposed to know as a parent but don't know, as well as a specific one on breastfeeding to help if there's any issues with breastfeeding. So thanks for listening and congratulations. Bye-bye.